welcome to the world of Wellbeing. We are going to start a series of 5 questions to mental health disorders. The first disorder we're going to talk about is attention deficit hyperactivity disorder. Most people know it as ADHD. The format of our conversation or of this talk is going to be 5 questions which go like, what is it and how does it present? Who gets it? How is it managed? And how do we keep ourselves better, whether we want to prevent it or even when we have it? So the first question about ADHD, what is it? This is a neurological and neurodevelopmental disorder which often will start in childhood. So most children are diagnosed during their primary school years. However, some people can get diagnosed much later in life as well. It usually presents with hyperactivity. So this is a child who will be unable to sit still, especially in circumstances where they are meant to be sitting still, for example, in classrooms or in a quieter setting. They can also present with the need to move up and down or to be running up and down all the time. They can also present with wanting to jump from furniture and so on. The other thing that they can present with is difficulties with concentration, so that's the inattention, and this often is heard from the teachers that they have an extremely short attention span, bearing in mind that every child is different. And the last point in presentation is the impulsivity, is that children will not be thinking before acting, and they can be finding themselves in accidents or bumping themselves. The one important thing to note is that these presentations need to appear in more than one setting, and tend to be both in school, at home, in all the clubs and so on. So there has to be a pervasiveness in the way they're presenting. Those are the 2 questions answered. So what is it and how does it present? Third question is, who gets affected? Tends to be boys, but it can actually happen in girls as well. Girls sometimes tend to have an attention deficit disorder where they often will be what is called daydreaming. They are slightly calmer, but actually they're not able to learn. How do we manage? The first thing is having routines and knowing that each child is different and managing those expectations. Any child has a potential to do very well despite how they present. So the first thing to know is to know our children and be able to give them short bits of instructions. One thing that is difficult in ADHD is a child receiving a few things that they need to do at the same time. So single instructions which are repeated is very important. Putting some routines where they know what to expect is very important because it's a learned experience, but also arranging either the household or circumstances so that they're kept safe and so that they're also enjoying their lives. One of the other things which is key is to allow them to have positive experiences, to allow them to do what they're good at. So if they are more energetic than others, put them in clubs where that energy can be burnt off. When some of these symptoms are much more entrenched, and especially when a child is unable to learn, medication can actually be used. So attention deficit hyperactivity disorder is a disorder which is treated with both stimulant medication and non-stimulant medication. Stimulant medication known as, some of them are things like methylphenidate or lisdexamfetamine. Those have quite a good effect when used properly, but never use them without having a specialist input, because they need to be followed up both in terms of their effect and in terms of monitoring any side effects. There are many other medications which are also non-stimulants and which help children as well. the last question is, how do people stay well even when they have ADHD? So in terms of the prognosis, we do find that there are three groups. Some children will grow into adulthood always needing some input. However, up to 60% of children, by the time they reach adolescence, they no longer need this treatment and they would have picked up good habits and they can do well. However, there's another, out of that 60%, there may be half of those people who may need treatment when they have to go for exams, for example, or face anything which needs more of an attention. So that's all for today in terms of attention deficit hyperactivity disorder. I hope that was helpful.
If you would like help with this or any other topics that we discuss on our videos, please don't hesitate to reach out. We have a Destiny Hope line, which is available 9 to 9 every day, ready to talk, and the number is 0333 900 909, or you can email the address shown below, which is wellbeing@destiny-church.com, and we would love to address your concerns and just have a chat with you about anything that is worrying you.